And we are back on Open Line. Glad you're watching this evening. We are talking with our expert here this evening, endodontist Dr. Christopher Sandlin from Bluegrass Endodontics. We're talking about your teeth. We're going back to our phone lines right now, and Alfonso is on the line with us. So, Alfonso, good evening, and do you have a question or a comment?
Yes, sir. Good night. The question is, I don't have an insurance on any kind of the insurance. What about I need a trident? The only thing I got it right now is Aflac. I need a trident maybe for 50% of my caries. They cover?
As far as do they cover?
I don't know the answer to that. That's a supplemental type insurance. I'm not sure I know the answer to that question.
And there is, and Alfonso, thanks for calling in this evening, but I know that a lot of times people don't have dental insurance,
right,
or they've used the dental insurance up, but there are certain places that you can go for dental treatment.
Right. Interfaith is the first that comes to mind, and they handle your treatment on a sliding scale based on what your income is or your ability to meet that need. They'll work with you. And there's also Care Credit, which is a great option that allows for a low interest or no interest financing of those dental needs so that you can take care of what you need to have done.
So Alfonso, if you look those up, you can just Google that online and you can find some more information about that. All right, thanks for calling in this evening. We appreciate it. Now, as we were talking a little bit about myths and fact and fiction as far as root canals go, because I know there's a lot of misunderstandings about those. One of these, is this a myth? A good alternative to root canal treatment is extraction, pulling the tooth.
That would be false. If you can save the natural tooth, that's the best option. That's going to provide you the best function. It's going to retain the bone that is only there solely to support that tooth. So when you see pictures of the emaciated elderly jaw, the edentulous jaw, it's that way because there are no teeth there. You take away the teeth, you take away the supporting bone, that jaw gets very spindly looking. So saving the natural teeth is always the best option, and it's the most efficient use of your money. As you start looking at replacement options, i.e. implants or denture supported implants, that sort of thing, the bridges, the cost actually goes up. So if you save your tooth, do the hard part, keep your teeth clean, good home care, good visits, save your teeth, do a root canal if necessary, put a crown on it. It's going to save you money in the long term.
Okay, what about when you do have crowns? Is the process any different if you need a root canal?
No, we just have to go through the crown. Generally, we can't take the crown off. It's permanently cemented. If we try and take the crown off, it's going to destroy the crown. But we're pretty successful at going through the crown in a conservative way. So it's just a small footprint. We go through, do our business, and then when we're done, we just seal it up, or you go back to your dentist, and they'll bond in a tooth-colored filling that matches the crown or whatever that material is to permanently seal that up.
So basically, I know some people have that fear if they have a crown, they're like, oh my gosh, I don't want to, you know, but you're basically, you save the crown. It's not like they're going to lose the crown when they have a root canal.
There's always a possibility when you drill through a crown, number one, that we could find something inside the crown, recurrent decay, which may have been the factor that warranted the root canal. We may find things that indicate that the crown may need to be replaced. But generally speaking, I'd say 95% of the time we can go through the crown in a conservative way, whether it's with carbide burrs or diamond burrs, and we can get to what we need to do, and then when we're done, we just seal it up.
And if someone has had a root canal on a tooth, is it possible that they might have to have another root canal on that same tooth?
It is, and this is one of those things where people think, I've had a root canal, therefore I'll never have to worry about this again. And that couldn't be farther from the truth. Just like bacteria can get inside of a tooth and irritate, inflame, or kill a pulp, it can also get inside underneath the restoration or through a crack, and it can contaminate the rubber filling that we place inside the tooth. No matter what we put inside the tooth, no matter how well we disinfect it, if it's subjected to bacteria, that bacteria will find every little crevice and eventually get down to the tip of the root and cause problems. So sometimes, unfortunately, it is necessary to redo a root canal. I tell patients root canals don't go bad like the tread on your tire. They don't just wear out. As long as it's done correctly, disinfected, you get a nice restoration that seals that root canal, you'll keep it the rest of your life. But there are other factors at play.
Okay. I was telling you a little earlier, there's a commercial on right now, and it talks about your enamel. And it says, you know, if you don't protect your enamel, once it's gone, it's gone. You don't get a second shot. And they're, you know, advertising basically a kind of a toothpaste that you would use for that. Are people aware of that, or is that kind of stretching it in what they're saying in this commercial?
I believe that's true. I mean, to a certain respect, you're given all the enamel. You don't continue to grow it.
So it's not like something that's going to come back.
No. As you wear it away, and one of the big factors in that is more of an acidic diet. So if you enjoy sucking on lemons, you may want to think twice about that.
And I think that's another thing when we're talking about some of the foods, when we're talking good foods versus bad foods. What are some of the foods that people eat or in a drink or a beverage that they think is probably good for their teeth, but not necessarily so? I mean, like fruits with acids and things like that.
Right. I'd say fruits are, on the whole, good for your teeth. It's not the same kind of sugar. But no matter what the food stuff is, if you leave it on the tooth long enough, bacteria will adhere to it, produce acid, cause cavities. The most important thing is no matter whether you drink sodas on a regular basis or you just have a penchant for sweets, if you get in there in a timely manner and remove that from the tooth, you don't let it just bathe the tooth for 24 or 48 hours, you're going to prevent the cavity process from happening.
Okay. And now, we only have about 3 minutes, so if you do have a question, make sure that you give us a call in these final 3 minutes that we have. But I know people, too, when they go in to have a root canal, sometimes they're worried, do you, the nitrous oxide, that sort of thing. Tell us kind of about that, and do you recommend that?
Well, if that's what it takes to make you comfortable, then that's an option. We use multiple different types of local anesthetic, some that act quicker, some that last longer. We've got a number of anesthetic techniques and placements to make sure that tooth is profoundly numb. In addition to that, we can use the nitrous oxide, which helps to relax you. And if that's not going to be sufficient, there are other levels where we can use oral conscious sedation medications, which basically almost puts you in a nap-like state. Although it's not sleep dentistry, you desperately want to take a nap. And it has a great amnesic effect. So generally speaking, when we call patients the following day, they don't even remember being in the office. So there's a number of different ways that we can take care of different anxiety levels. But the vast majority of patients do extremely well with just straight local anesthetic.
Okay, and in just about the final minute, I would like, if someone is just tuning in right now, to kind of review reasons. We talk about when you go to see the endodontist and that kind of thing. So, and you a lot of times go to the dentist first. But as far as going to see the endodontist, what is that signal that you might need to go see the dentist to get recommended to the endodontist?
Generally, it starts with the temperature sensitivity. That's the first indication. Hey, this tooth, it hurts. It's more sensitive, especially to cold drinks. As that tooth becomes more and more affected, meaning the pulp on the inside of the tooth, that temperature sensitivity will progress to something that's an exaggerated response, and then that exaggerated response will progress into something that's lingering in nature. And then that will progress into something that just happens spontaneously. So the buzzwords that I typically talk to patients about are lingering, spontaneous. Those are by far the majority of the symptoms that when patients suspect that they need a root canal, that's what we're talking about.
Okay, well, good to know. I think we are going to take a break. When we come back, we will get you the information on how you can contact Dr. Sandlin at Bluegrass Endodontics. I think that is right, Courtney? And we will do that right after this break, so come on back with us.